Alberta is now the undisputed measles capital of Canada, proving once again that we are the best at all the wrong things. On Monday, the government finally decided that we might have a problem and unveiled a response plan, which is adorable, except the house has been burning since March, and they've shown up with a garden hose, a lukewarm apology, and the same personal responsibility bullshit that got us here in the first place. Since March 2025, Alberta has logged 868 confirmed measles cases, the worst outbreak in nearly 45 years. Every single health zone is affected. This isn't a spike, it's a full-blown crisis, decades in the making. Years of anti-science politics, gutted public health care, and Facebook-fueled nonsense about autism and other unfounded vaccine side effects has brought us here. And no half-baked action plan scribbled in a Monday morning panic is going to fix it. Not when the rot runs this deep and the denial runs even deeper. Measles is one of the most contagious viruses on Earth, with an R0 of 12 to 18. And that means one infected person can spread it to 12 to 18 others if they're unprotected. According to doctors and scientists, we need 95% immunity to stop measles in its tracks. And Alberta isn't anywhere close to that. At least, not anymore. All across the province, rural areas, urban areas, take your pick. Vaccine coverage is in the danger zone. Standing exposure advisories have basically become a lifestyle. Measles is tearing through communities like it's 1979 and people are still chain smoking in maternity wards. It's retro, it's reckless, and it's entirely preventable if anyone in charge had bothered to act before the outbreak made headlines. And while Ontario, New Brunswick, and other provinces are seeing rising cases, Alberta leads the country per capita. But are we really surprised? This is a province where voters lose their minds over kids learning about gender identity or seeing a drag queen at the library, but they have no issue leaving their children unprotected from a deadly, entirely preventable virus. Protect them from books, sure, but not from disease or death, you fucking idiots. A recent poll found that 22% of Alberta parents are vaccine hesitant or outright opposed, and 37% think vaccination should be optional because not everybody believes in vaccines. But let's be clear, we don't hand drunk drivers keys to their vehicles and say, get behind the wheel, just because they don't believe in intoxication. Public health isn't a choose-your-own-adventure. Measles was a problem, and we solved it years ago. And now we've turned classrooms into petri dishes of disease. When nearly half the population values their own opinion above science, that's when you get an outbreak. Being anti-vax isn't a lifestyle, it's a liability. It doesn't make you granola, it makes you a threat. And it's not just your kid you're putting at risk either. It's the baby they sneeze on at the daycare. It's the immunocompromised classmate, the grandparent recovering from surgery, the cancer patient undergoing chemotherapy. Your personal choice doesn't exist in a vacuum. It exists in a community. And right now, it's endangering lives and dumping even more pressure onto an already underfunded, overstretched healthcare system. And the Alberta government's plan is far too little too late. The damage is done. We're practically starting from scratch. We can't just flip a switch and fix it now. We need bold, unapologetic action. Mandatory school entry vaccinations with medical exemptions only. Religion and Reddit no longer count. Rapid catch-up clinics in under-vaccinated areas, especially in rural zones that have been politically pandered to instead of served. Blunt, myth-busting public education campaigns. Call out misinformation. Name it. Shame it. Burn it to the ground. And yes, some people can't be vaccinated. I understand that. I respect that. But that is exactly why the rest of us who can be vaccinated have a responsibility to ensure that we are. Because this outbreak is not just tragic, it's a case study in what happens when ideology steamrolls expertise and conspiracy theories take the place of community care. We're not just fighting a virus, we're fighting the fallout of millions of people doing their own research because they don't trust doctors. Vaccines work. Science works. What's broken is us.